Welcome to Medicine with the Metals. I'm Mark. Michelle's not here today, but we have a really great guest, Seth Mehr.
Thanks, Mark, and yeah, thanks for having me. I really appreciate the opportunity to be a guest on your show. Appreciate
Thank you.
what you're doing on this platform, the education, the awareness, the advocacy that you and Michelle are doing is wonderful. So, thank you.
Thank you so much. Let's go ahead and introduce yourself. You have a very, you know, somebody like you really can tell a really powerful story from where you came from. So why don't you go ahead and introduce yourself, tell people what you're about. We'll go from there.
Sure, absolutely. I live in Portland, Oregon. I was an emergency room physician for about 20 years. Left the emergency room to practice psychedelic medicine full time. Founded a clinic called Cascade Psychedelic Medicine, where I primarily work with ketamine, doing IV ketamine therapy. I host group psilocybin sessions. I'm a state licensed psilocybin facilitator. I serve as a health and safety director for the Intertrek Psilocybin Service Center in Portland as well. I've been involved with an MDMA clinical trial, providing medical support for that as well. And so, yeah, that's professionally where I am right now. I grew up in South Florida, bounced up and down the East Coast for a bit until uh, 2000 when I moved out to Portland.
All beautiful things. Psychedelics have really come to the mainstream in the last few years. A lot of people are really, you know, have a different perspective on them now than we used to. Oprah just came out, what, maybe a few weeks ago, just talking about where she's been in the last 10 years and how she's really navigated towards, accepting these as a real medicine because that's what they are. They're a medicine and they really help us get stuck when our stuck mind is just stuck. And, I've
Mm.
never seen anything for myself. That's why I'm in this space. I've never seen anything do what psychedelics has done for me. Like starting with ayahuasca was my first medicine, my first experience with psychedelics. And what that did for me was just like show me a whole new paradigm and show me that the way I was living was like not truth. And from there on in, I just started diving more and more. I just truly believe that the more we educate and the more we inform and the more we bring this to the surface, people will start accepting because it's a beautiful medicine. There's so many like ketamine, MDMA, psilocybin, ayahuasca. We can go down the list. All these all these medicines help us see things differently in ourselves.
Yeah, absolutely. I agree 100%. And that's something that you and I share. I really kind of entered the psychedelic space in earnest through ayahuasca as well.
Mhm.
For me, about 17 years ago, had a very profound experience and firsthand as well learned the power of these medicines.
Yeah. They're just they're just something that there's something there that I think we're just touching the surface on because, since the 60s, we haven't been able to explore these. And I think people are diving into these without that science, we're educating them and they're seeing that these aren't scary medicines. They're not. I mean, they're meant to be a little scary because anything outside of fear is your joy. Once you face that fear and you go beyond that, there's your joy. There's your essence of life. And you know, I just I really have a full believer in these and having people like you on that solidify this. Like you're a doctor. People are gonna trust you and what you say. And that's where we are in this Western world. They're gonna trust people like you. They're gonna see Seth Meyer. They're gonna say, oh, he's done this. He's gonna give me the right tools to navigate this path. So how do we navigate this path?
Yeah, it's a great question. I don't think there's just one path. And yeah, I recognize that the medical system is one of those paths. It's certainly not the only one. I think the medical system has a lot to learn from the traditional uses of psychedelic medicines. And um, I like what you said about these medicines helping us kind of confront our fears, confront our darkness, confront our trauma, help us connect to those more foundational parts of ourselves that, when addressed head on, can promote long lasting healing. I think that's one of the main differences between psychedelics and more traditional psychiatric pharmaceuticals. We're not suppressing emotions, we're not blunting emotions, we're diving straight in, maybe accentuating them and learning how to use that. So, this is something that the medical system needs to learn and hone.
So, what pivotal experience led you to this? What pivotal experience did you have that you were led into the psychedelic space?
Yeah, good question. I think really two pivotal experiences come to mind. The first is when I mentioned um, my first experience with ayahuasca. It was at a time when um, my family was struggling. My wife was in the middle of postpartum depression. We were struggling being new parents, and both of us experienced profound changes through ayahuasca. And for me, recognizing how important, how powerful this medicine could be, and then carrying that into my medical practice, into the emergency department, where I'm seeing the lack of tools, the lack of resources, the kind of revolving door of mental health crises, seeing patients coming through the ER again and again, and us as a system not having adequate resources to help people, and carrying my own experience where I recognize that there are these incredibly powerful medicines that are out there, but we're not allowed to offer them. We're not allowed to talk about them. There's a lot of dissonance that I carried in my medical career with these two things, um, at the same time. So that was really important. And then it was really skipping for me to the kind of beginning of COVID.
Mhm,
I had to take some time off of work on medical leave. I had to have spine surgery,
mhm.
and I had a setback, a complication, recovering from that. I had depression and pain, and kind of spun out into a dark place pretty rapidly. And it was at that time I was looking for help for myself. And that's when I kind of rediscovered ketamine in ways that could address pain and depression, which was not how I was used to working with ketamine. I had been using it, essentially as an anesthetic my whole career in the ER, but it was seeking help for myself, where I then both received ketamine, got some additional training on how to use ketamine for mental health applications. And for me, one session receiving ketamine just pulled me out of that hole, and helped me so quickly and so significantly. And I recognized it as a psychedelic, even at the kind of low dose protocol that I had received it, that had been used traditionally. I recognized it as psychedelic. So um, it occurred to me that I have access to this psychedelic. I had been trained how to use it. I was familiar with it, and I didn't feel like it was being used to its fullest potential. But that was a big impetus for me to to learn how to work with psychedelics, and knew that ketamine was sort of the bridge for me. This was also the same time when Oregon passed its psilocybin measure, and so I knew that psilocybin was soon going to be legally accessible in Oregon, and so all of these things coming together helped me um, start a career in psychedelic medicine. I'd actually tried to initially get a ketamine program started in my emergency department because there was already some literature that showed that ketamine can be helpful for suicidal ideation. And in the emergency department, this is something that we see very frequently, and again, have very few tools and resources to help in this situation. We literally had that medicine in the ER. We had providers who were trained how to use it, and it seemed like such an obvious um, place to help. But I was unsuccessful in getting that program uh, started, and so that too was impetus for me to start my own clinic and to provide this in a way that I thought would help kind of maximize the potential for meaningful psychedelic experiences.
Okay. COVID was a really interesting time. COVID really, I think that's really when I brought me to my knees of the psychedelic experience. And I think we had some time once we did those experiences to just not do anything afterwards, which I think was really gratifying. I did my first psychedelic experience right before COVID. And, it was just after that, I had time to just sit with myself. And it
Mhm.
was pretty powerful. And let's explore, let's help people understand something. Like ketamine is a difference than ayahuasca. Like these are two different medicines. Ketamine is different than psilocybin. Ketamine, my stepdaughter got really her breakthroughs where she really got cured with her depression was through 3 intravenous ketamine injections, and she's tried everything, and after that, it was like that really changed. Some people it works for, some people it doesn't. It's just a different kind of experience. Can we explain what a ketamine experience is for some people?
Yeah, absolutely. And you're right. And it's a good question because ketamine can be used in so many different ways. And
Mhm.
there's no singular ketamine experience. Um and here's why. When ketamine is given at lower doses, there can be some, mild intoxicating like effects. It can help with pain. It can facilitate therapy, but it's not a psychedelic experience. We call that a psycholytic
Mm.
dosing, psycholytic experience. At very high doses, it produces unconsciousness. It's an anesthetic. You can do major surgery while receiving high doses of ketamine. And there's a narrow range of um, ketamine levels circulating in your bloodstream that will produce a psychedelic experience. That range is different for everybody. So everybody has their own sensitivity and tolerance to ketamine, just like they do with any other medicine. And so with IV ketamine, at least the way that I provided in the clinic, what we can do is by giving a continuous infusion, continuous drip of ketamine, we can adjust the dosing in real time, and in a collaborative way can help get into that zone where you can have a mild, medium, or deep psychedelic experience. And so I don't think there's necessarily a way to characterize, a ketamine experience feels like this, and an ayahuasca experience feels like this, and a psilocybin experience feels like this. I mean, yes, for each individual person, you recognize what each of these medicines feels like. You have your own relationship, your own experience, your own reaction to each of these. But what I've found working with these medicines over time is that, one person's ketamine experience can feel like somebody else's psilocybin experience, can feel like somebody else's ayahuasca experience. And of course, there's so many factors, both, the individual, um, the setting, the presentation, all the other, stimuli around you. It's like um, taking psilocybin with an eye mask and headphones and a playlist on in a quiet room is a completely different experience than taking psilocybin at a music festival, right? So there's not just one singular experience. That's what's so unique about psychedelics in general. One of the reasons that I think the traditional medical system has a hard time wrapping their heads around what these things are. So yeah, so I don't think there's a singular ketamine experience, but there's a way of working with it that can help, um, produce an experience that can be profoundly helpful, for each person receiving it, and that looks different from one person to the next.
Definitely. Definitely music is magic with psychedelics. Something about music is magic, you know? No matter what psychedelic, it's even if you do like a boga, you're talking weedy music. It could drive you nuts when you're in that ceremony, but it is just something about the music is the magic in the medicine. And what do you think it is about our science? What do you think it is about the Western world science that they're so restricted to this medicine? Why do you, they know it works. They know the science is there, they know it helps with almost all our mental issues, but what is it that prevents them from going full blown? What prevents this? Why is there so much restriction? Everything like I've heard you mention 3, 4 times already. You were restricted. You had to stop. What? Why do they keep restricting a medicine that's really going to work? There's nothing that works. I couldn't give anybody Wellbutrin or any SSRI and say you're going to change your life with this. Okay, but I can actually sit with somebody in an ayahuasca experience or a psychedelic experience with psilocybin. And I can say, you're going to change your life. This will change your life. You'll have a new outcome after this experience if you want it. What is preventing science from moving forward with this medicine?
Yeah, it's a great question, and, when I hear you say it that way, um it has this overlay that science is bad or science is preventing forward progress. I don't totally see it that way,
Mhm,
um, but it's what's happening is psychedelics don't fit the mold very well. They don't fit into the paradigm very
mm,
well. The ability to create, um double-blinded, randomized, placebo-controlled, clinical trials is very, very
mm,
difficult with psychedelics, and that's the standard that the scientific and medical community uses to allow access, to approve, to, change the, controlled, substance scheduling, to, get insurance, companies to pay for it. And just like you're saying, the music that you're immersed in a psychedelic experience is a very important part of how the medicine works. The therapy surrounding the medicines, the setting, the preparation. These are things that are confusing to the medical system, right? Like the recent, situation where the FDA didn't approve MDMA. They have a hard time grappling with a pharmaceutical plus um, an experience. These are hard things to control for. So I think it's going to come through the medical
mhm.
system, through the scientific system. But the reason it's taking longer is because psychedelics don't fit as easily into traditional ways of doing clinical trials, and you need to have large numbers of people going through clinical trials to be able to, in the again, the scientific community's eyes,
Don't we
prove
have that
safety
though,
and
Seth? Don't we
efficacy.
have that now? I mean, haven't we seen that without the science? Haven't we seen thousands of people go through an ayahuasca experience, change their life? Thousands go through a psilocybin experience, change their life. Thousands ketamine. I can go on and on. Isn't the science there? Is there I really haven't seen in this space too many people that have had adverse effects. Really, like, I just haven't. And, to me, that's science. To me, that's nature. To me, that's God. To me, that's like, this is the real deal. I mean, manufactured pills are not the real deal. And most of these manufactured pills are coming from nature. So it seems like, it seems to like me as a person that really is a true believer in these medicines with nothing else, that there's the science. Look at how many people are healing from this medicine. I mean, why do
Yeah,
they have to be in some kind of constructed room?
yeah, I agree with you 100%, and the stories, cannot be ignored and are not being ignored, and now, we do see the scientific community doing these trials and learning and starting to be flexible and adjusting, um, and, it's happening,
Yeah.
and I agree with you 100%, but I think this is why it's behind. This is why it's
Mhm.
being delayed right now. And I'm not necessarily saying that I agree with that, but that's
Right.
the situation, that
That
we're
we're in.
in right now.
Yeah.
But we're, as a community of people who believe in this modality, we're finding ways, right? And like ketamine is a good example. I'm, every day in my clinic, facilitating deep and powerful psychedelic experiences for people who have not found other options, and this is legally accessible. In Oregon, we're doing it. We're providing legal psilocybin, um, sessions for people who are seeking this out. Colorado's doing it now as well. So we're making progress.
Good. And I think this, let's talk about safety a little bit, because I think a lot of people, we've been really brainwashed with, you're going to take this medicine and you're going to take some psilocybin and you're going to freak out. You're going to the stories. The stories go on and on. It's always a negative aspect, and people are scared. Oh, scared to throw up. I'm scared. Tell me what you feel about the safety aspects of these medicines.
I think overall, these are very safe medicines. They've got long historical uses, um, and there are risks. They may be low likelihood, but can be high risk. Right? Like
Hmm.
people have committed suicide after using psychedelics. People have developed psychosis. People have
Hmm.
developed perceptual disturbances that are long lasting. They do affect our internal organs, our physiology. They do have some risks. I don't. I think even if they're low likelihood risks, they're real, and creating a system so that we are um, fully informing everybody who approaches these of the risks, letting um, clients make well-informed decisions is an important part of safety. Um, there are a small percentage of people for whom this is not safe, and developing a system to screen and recognize when that's the case is important. Some people have complicated, fragile medical conditions and may
Hmm.
not be safe. And again, I don't want to blow these out of proportion, but there's um, a difference in longstanding historical use of psychedelics in other cultures, and kind of a self-selecting group of, say, modern Americans who are traveling to use psychedelics in these contexts, versus opening the doors to having access to psychedelic therapies in the United States in 2025, um, with a population that's not necessarily super healthy. We have
We're very sick, Seth. We're a very sick population.
Yeah. Yeah,
Hmm.
and so there's so recognizing that, I think, just creating some, standards, protocols, processes, sharing good information is important part of keeping this safe and sustainable.
Interesting. So you Cascade Psychedelics is your company, correct? Is your office?
Yeah, Cascade
So,
Psychedelic
and that's in Oregon.
Portland, Oregon.
So could you kind of run somebody through a scenario of what it looks like for somebody to come and visit you? What that looks like, because I think people, they want to know. They want to know, okay, what is going to happen to me? What is this procedure going to be? If it's going to be psilocybin, if it's going to be ketamine, what does it look like?
Yeah, absolutely. So, we start our process doing some health and safety screening. So that involves filling out some health forms as you would for going to any new doctor or clinic in a traditional system. Sometimes I'll ask for additional records to review. Maybe somebody has a seizure disorder, heart disease, psychiatric illness. I'm going to communicate with their providers and set up a kind of team-based approach for this so that I can get additional details, make sure that the clients, other providers are kind of on board to support this client and aware of what we're doing. Once we get all that information, we meet, we talk. We have you come into the clinic where we can sit down, usually for a couple of hours, and both have a conversation to explore what your motivations are for seeking this out. Why are you here? Let's explore that in detail. Let's develop a relationship and allow me to listen and understand you and what you're here for exactly. We want to, with time, build trust and understand traumas, backgrounds, relational dynamics, and go into these sessions with that level of vulnerability and trust and openness to exploring and going deeper into some of these more root issues. I also will spend some time in the room where we're going to do these sessions and help a new client just get comfortable in the space, get comfortable with me, get comfortable with the room. I may play music for you before we ever do a medicine session to start to get familiar with what the environment is going to be like before we introduce the psychedelics into the space. We're going to make sure that you have a support system that may be an integration coach, maybe a therapist, a spiritual provider, and make sure that we have a team that's supporting each person through this. We'll also talk about options, right? So, an individual ketamine session is one option. We'll talk about what that looks like as far as frequency of sessions, how long the therapies may be, and get a sense for what may be necessary, what to expect. We might explore psilocybin as an option and talk about the differences between ketamine and psilocybin and which may be right for you right now, and that can change over time as well. But we'll talk about all of those options. And yeah, and then again, let's say we decide that ketamine feels like the best place to start. We'll come in for a first session. We move slow in the clinic. We take our time. We have respect for the the process and the experience, and so nothing is rushed. We check in and talk before each session, both about intentions for that session. It's not a mandatory um, piece to have a specific intention. In fact, often for the first couple of ketamine sessions, I really encourage people just to come in with a mindset of getting comfortable, getting familiar, observing what you're feeling, how you're responding, taking in the music and the environment. So I don't like to put too much pressure on having any specific expectations or trying to control a psychedelic session, especially in the beginning. And we talk about dosing, and talk about how somebody's feeling in the moment, and start to share that, name that, practice some vulnerability, practice some openness, um, allow yourself to be in a mindset to receive medicine and to be in a psychedelic space. There's a ritual component to this as well. So after we're talking and checking in, and say we've put the IV in, we've gotten vital signs, we have a really nice recliner in the room. We'll lie that back, turn the lights down. We may, light some incense, do some intentional breathing. We're going to transition from a conversation into a space that is comfortable and relaxed and ready to receive the medicine. And then when when client feels ready to start, we'll start that infusion. And again, this is a very unique way of having a psychedelic experience when you have somebody in the room with you who can literally turn the dial and adjust the intensity of the experience so that, say, especially for a first experience, we can start low and slow. Just spend some time getting used to the initial effects, what it feels like in your body. And when you feel comfortable, we can gradually go a little deeper into the medicine. I'm checking in and asking how somebody's feeling. Are you feeling the medicine? What does it feel like right now? And helping somebody at their own pace and comfort level get into that psychedelic space where the more profound and meaningful changes are taking place. Now, while a client is receiving the medicine and in the psychedelic space, I'm playing music, and so I play instruments, essentially providing a sound bath type of environment in the medicine, and have um, singing bowls, chimes, drums, rattles, handpans, gong, flutes, lots of different options available to help support the experience, to help evoke a full range of emotions in the experience. I consider the music a communication tool as well. The environment is filled with music, which also kind of taps into more traditional ways of using psychedelics in other cultural contexts, like you mentioned. And so that's what the session looks like. And again, if somebody starts to get, really uncomfortable, scared, disoriented, anxious, if we can't work through that with the music and with talking through it, we can turn the medicine down or turn it off. Right? There's an off switch for this,
Mm.
and that's not the case with psilocybin, iboga, ayahuasca. So
There is
it's
no off switch there.
there's no off switch, and
Y
while on one hand, practicing
mm,
surrender and
yes.
being in that space is profoundly, helpful, and there's another way to do it. And for some people, having an off switch, being able to turn it down, having some agency, to be able to do that can create a whole different layer of safety that over the long term and multiple uses can help somebody learn how to use psychedelics, learn how to develop a relationship with them, learn how to go deeper when you have that ability to make adjustments. So it's a very unique collaborative way of being in a psychedelic space. And
It
then we
sounds
create
absolutely beautiful and sounds like you really you've really done your homework to get this done, you know? Because I see this right now. I see a lot of people, like you mentioned, like I think the biggest thing in this space is like the experience is just the experience. You know, an ayahuasca experience, you know, it's the experience. It's what you take after that. If you just sit in that experience and go home and you do the same thing, you're just an experience. You know, these are just the most important part about all this is that integration, that changing. You got to change what you were doing before. You have to integrate the change. And, you know, integration is just thrown around in this psychedelic space so much. And, you know, a lot of people don't understand it. But for me, I think for me, what integration is sometimes you don't know what happens in these experiences. You're just like, what was all that about? But it opens portals. And I think when those portals open, you are so much more in tune to accept new thoughts, new processes. And, you know, it's really hard to accept in the beginning. You're like, portals, what are these? Or what, you know, what are you talking about? But we have these portals in our body that when we open them back up and they're not blocked, the magic.
yeah, really really well put. I agree with you 100%. And, you know, what does that integration look like? How do you recognize what the portals are?
Mhm.
How do you how
Let's
do
talk
you
about that. How do
nurture
we? How do you? How do you? Or how do I? So we can explain that to people.
Absolutely. Yeah, absolutely. It's such an important and individual process. Again, there's not a one size fits all approach to integration. So I approach integration in phases, and integration starts in the room when the medicine session is ending. Um, I think that's when the integration starts, and that for me starts with giving some time and space to start to kind of just pull some of the raw material out from that ethereal experience and into the material world. That may start with talking, sharing. Maybe it's way too early to start to tell a story and to extract meaning and to have something written down that you could explain to somebody else. Maybe it's more. Maybe it's more nebulous. Maybe it's more ethereal. Maybe it's a feeling. Maybe it's something in your body, something emotional. Maybe it's images that came. And so we start by just trying to either talk and share and um, bring those insights into our conversational space, um, or it may have to come through something more artistic. So in our clinic, um, we have an integration room, and we have um, journals, we have sketchbooks, we have a collage station, we have multiple different kind of crafts that clients can use to start to pull some of the experience from that psychedelic space into the material world. And so creating time and space and encouragement to connect with those things and um, ultimately try to leave the clinic with something physical, material that is representative of that experience home with you so that you can kind of use that to build on, to reflect on, to add to maybe bring into an integration session with your integration coach or your therapist the next day or later that week. Um, and and then, slowly over time, as it starts to become more clear what that experience was, what that meant to you, what you are learning is associated with those more foundational, root core issues that have been affecting you. We start to bring that into other practices to help nurture that, making change, like you said. Maybe that change is something physical related to your body, finding an outlet to connect to your body in new ways. Maybe that practice is something relational, fostering connections with people in your life that are supportive, or a relationship that needs repair. Maybe that's fostering connection to the natural world and being in nature and exploring um, your your connection to nature. Maybe that's
How
traditional
about exploring
therapy.
our breath a little more? Like, I think we lost our breath. I think we lose, like, our breath is so important. I mean, I know how I breathed before this, and I know how I breathe now. And it's like, I don't even know how I was breathing before. I think breath is such an important thing because it opens it opens these gates because we come to these medicines to find love. Okay, there's nothing besides love, you know. So love is the answer. And like most of us don't even know love because we've been like pushed to the curb for so long. But I guess when you really experience that first love in a psychedelic space, something changes, because, at 50, I finally found love. And even like I sat in an ayahuasca experience last week, been a long time, and I sat in one and I went to the medicine man. I said, why don't I love myself? Hmm.
Hmm.
Even after all this work, I still like have a tough time, you know? He's like, well, it's not about the medicine. And I said, it's not. Medicine's a fantasy world. It's about gaining the insights from the medicine and starting from like the ground one and working back again, like reinforcing the love for yourself and really, you know, good food, good health, keeping your body healthy, And these are things I kind of forget as I move on in this space because at the end of the day, it is just about love. It really is. And, I think we all have a hard time accepting that because we live in such a non-loving world or non-loving society. But, if you really go to the indigenous and you really go to where these medicines started, these people love. They just, it's it. And it's really something that I think we don't get in touch with. And once we do, man, doors open. So even as long as I've been in this space, sometimes it's hard for me to understand how I get back, and followed that love and, I found it again. And, that's what it takes to find it again. It's
Oh,
pretty
yeah.
cool.
Mark, that's beautiful. I appreciate you sharing that, and what a powerful experience, that reorienting to what's most important, right? This kind of rat race that we're in society, and kind of what our society teaches us is important, or how we should be spending our time. The messaging that we receive, in the media in particular, constantly, is at odds with reorienting to loving ourselves, loving each other, and to have, an ayahuasca experience, um, shift that perspective, and to reprioritize, um, love as the anchor and the center point for how we approach everything. How we approach work, how we approach relationships, how we approach care to ourselves, how we approach what we eat, how we breathe, how we move through this world. Right. This is, um, this is part of the magic of psychedelics. Um, Wellbutrin doesn't necessarily teach us that.
Well, it doesn't, and, it's those the I just like to reinforce to people out there listening when they listen, you know, uncomfortability is the best spot to be in, because if you can get past that uncomfortability, if you can get past that fear, there's everything, you know? But it's so hard for people because we get comfortable, and I think psychedelics, when you really get to a breakthrough, you really break up break all those fears, and it breaks down, and nothing's holding you back, and then you can feel what you felt when you were 3 and 4 years old.
Oh,
You could feel that child, because all this is childhood. There's three things how we're raised. We're raised from family lineage, we're raised from DNA, and we're raised from childhood traumas. Our childhood traumas will just embed. So we forget what happened to us at 3. We forget at 7. The ego took over. I was bullied at 10, or this. And, you know, after a while, we bury that, and we become this force takes over, and it protects us. And, you know, it's not meant to stay there forever. It's meant to go back and heal that. And then you can live again. It's like we hold so much, especially when we get older. I think that's why you see a big influx of people right now, 40, 50, 60, really coming to psychedelics. Because what's life about when you're this age and you're like, I'm doing the same thing I was doing at fucking 30, and it's like nothing changes. Psychedelics help things change. It moves the mat.
yeah, I agree with you, and I appreciate your kind of naming that openness to being uncomfortable,
Hmm.
and that being an important part of this process, and that being an opportunity to really affect durable, meaningful change. That's a really big part of this, and it also highlights the courage that it takes for all of us to approach psychedelics,
Hmm.
to be vulnerable to psychedelics, and gosh, you're talking about the age range, the place in your life path when you're approaching psychedelics. That in particular has been so inspiring to me.
Hmm.
Um, I In fact, the first person that I sat for and facilitated a psilocybin experience for, was my mom when she was 73
Beautiful.
years old, and,
Beautiful.
yeah, and it was inspiring, um it was a very meaningful experience for both her and for me, and, and seeing and witnessing, um, you know, multiple clients I've had in their 70s and 80s coming to psychedelics for the first time, having been, um, incorporating that stigma of psychedelics for decades and decades and decades, and, being open-minded, being brave, and being willing to go back and address and open wounds, from earlier in life and in childhood, decades and decades later. Um, just incredible, to witness. So inspiring to be a part of that.
It really is, it truly is. And, I'm pretty big in the ayahuasca space and all these psilocybin space. And I'm seeing more and more of this, more and more of these elderly people coming that's never done this before. And they're coming out like, wow, why didn't I do this 20 years ago? Who cares if you did it 20 years ago? You did it now. So I think
Yeah,
we're in a really good spot, and a lot of people will do, let's jump a little bit to microdosing, because, this is a big thing now, microdosing psilocybin. A lot of people are just, it's like the new avocado toast. And I think it's really good for people, but I think people have to understand that microdosing is just going to be a small concept. It's going to really just, it's going to create new neural pathways. It's going to do things, but to get that big shake up, you got to go a little bigger. But microdosing is really popular. And I feel, and I don't know how you feel about this, but I think psychedelics, especially when it comes to psilocybin, and I'm just going to focus on psilocybin, is really an individual journey. And I think, I feel that if you're educated and you're informed, this is something you can really do sitting at your home by yourself, and you can really heal yourself there. How do you feel about that?
Yeah, I think you're approaching this is an individual process. That's something that resonates with me. I think that being able to develop a relationship with these medicines, to being able to develop a relationship with psilocybin, meaning, you know, what does psilocybin do for me if if I take a half a gram at home on a Sunday and create some quiet space for myself? What does it mean to take a gram of psilocybin when I'm camping and immersed in nature? What does it mean to take 3 grams or 5 grams when I'm in a safe, supervised setting? All of these are going to be different experiences, both the dosing, the environment, the mindset, the intention. This, like you said, is a very individual experience. So that's how I view it. I don't, view it, so much as a binary thing, microdosing,
Mm,
macrodosing. I view it
yeah,
on a spectrum of dosing, a spectrum of environments, a spectrum of intentions and approaches, and I think having, um, information, um, safety and access to be able to learn and develop a relationship with these medicines is a really important thing. And so that's generally the framework um, that I think about it and sort of put microdosing into that bigger picture.
you're such a great guy. You're such an interesting man, and you talk with such softness and clarity, and it's easy to talk to you. So let's let's kind of go into ending this podcast, which I love to go on forever, but we only have short time. So where do you see all this going? Where do you see psychedelics in the next 5 years?
In the next 5 years, I see expanding access. I see other states, besides Oregon and Colorado, creating um, regulated, legal programs. I hope to see more medicines accessible. I hope to see FDA approval. I hope to see insurance coverage. um, I hope to see accessibility from both a geographic standpoint, from a financial standpoint, a demographic standpoint. These are the kind of short term material changes that I think are going to happen in the next 5 years. But what feels more important about these logistics changes is building a culture of respect and safety and validation around the use of psychedelics in our culture, whether that's in a medical context, a religious context, a recreational context, a culture of safety and respect for psychedelics is, I think, um, what needs to be created, what hopefully will be created as we see more changes within our, traditional medical and legal systems, so that not 5 years from now, but 10 years from now, 20 years from now, the system looks totally different. And having widely accessible, safe and legal access to multiple medicines and a culture of providers, a general culture that can approach this, um, and weave it into our culture, I think is going to kind of redefine how we define health, how
Yeah,
we define mental health. It's going to shake up our traditional medical and mental health system,
for sure.
and
I
that's
think
what I
there's
see.
something going on right now that, I don't like to talk about politics a lot, but there's two good people that we have on our back right now, and that's Kennedy and that's Musk. I mean, love these guys or hate them. I just feel that Elon Musk has done a lot of psychedelics and he really understands that space well. Kennedy himself. I just have a feeling, and it's strong, that something's going to shift really quickly. And I don't know if I'm delusional with this or not, but I just have a feeling something's going to happen really soon. Because Oprah came out, and I mean, she's part of that big system. She just wouldn't come out and talk like this. Something's happening, you know? So something's happening.
I think this vision of in the spirit of health and healing. And
Hmm.
so I'm encouraged to watch how um, this is bringing people together from different ends of different political and ideological vantage points.
Beautiful. Well, let's end here. Why don't we tell people about your facility? Tell them a little bit where they can find you at.
Yeah, thank you. Cascade Psychedelic Medicine, cascadepsychedelicmedicine.com, Portland, Oregon, and Intertrek at intertrek.org would be the two places to go to find out more information about our offerings. Safe and legal access to psychedelics is one of the few bipartisan issues out there where people are coming together
Yeah.
and finding common ground and doing this in the
Well, thank you very much, Seth. You're a very powerful man to talk to, very educated, and I'd love to talk to you again, maybe in a couple months.
sounds great. Thank you so much. I really appreciate the conversation and the opportunity, Mark.
Thank you, man. Have a great day.
You too.